Hello, my name is Dr. Chris Fox, and I'm the chair of emergency medicine at UC Irvine. And you can see right here, I'm on the ambulance bay of our level 1 trauma center. We see about 50,000 patients a year in our level 1 trauma center. About 4,000 of those are trauma patients. And situated right at the Orange Crush, where the 55, the 22, and the 5 freeway come together, you can imagine how many car accidents we see, and the ambulances pull right up here on this ramp. But we have a very thriving educational program here. Everything from 8 different fellowships to 9 residents a year in our 3-year emergency medicine residency program, as well as a very thriving medical student curriculum as well. So I was going to take you inside so you can get a little peek here about what we're doing inside of our department. Our emergency department, we have a 75-bed emergency department comprised of 4 trauma bays and a whole bunch of acute care resuscitation rooms, as well as behavioral guesting unit and an ED observation. So you can see these are our 4 trauma bays here, A, B, C, and D. And I'll take you into one of these here. Make sure there's no patients. Nope. Perfect. So this is our, your stereotypical trauma bay. Everything you need in here to resuscitate a patient. We have all the equipment. We've got the, everything right here at our fingertips to do thoracotomies. And of course, ultrasound is a big part of our culture here at the entire university. And we have these machines here mounted to booms. So you can see they can be placed around the patient, 0 footprint, cables off the ground. Very handy having that system in place. And so we do a lot of trauma resuscitations in here, and we do medical resuscitations as well. We've got all kinds of airway toys to play with. You can see this is our store's CMAC device here. And we have basically every single thing you would need to bring somebody back to life. Just right around the corner from this room is our CT scanner. This is right through those doors back there. You get a sense here. And the CT scanner is right in here. Folks in here in the CT staff there. And yeah, just back to the main ED. Yeah, so this is where as the patients come in, we have them on the board. We can get the information we need as the phones. This is the red phone and the black phone right here. And more resuscitation bays in here. There's patients in there, so we obviously won't be going in there or there, but this is ED1. And you can kind of get a sense here of, it's early in the morning. It's not too crowded here, but you get a sense of ED1. This is our acute area where we do a lot of monitoring resuscitations here. And from ED1, we can easily flow into the resident workroom. This is where we have all of the teaching go down back here. This is where we get into the finer points of patient care and a lot of teaching. We have residents, medical students,
I don't know how to feel when you're
fellows.
with a giant stick.
Yeah,
It would be super helpful though.
Going through this door here. Computers everywhere, pretty typical on our Epic platform. Here's ED2. And then just coming through so we saw ED1, we just walked through ED2. And then down the hallway here is ED3. This is how we get to 75 beds, by having ED1, ED2, hello. And finally ED3 coming down through here. This is our COVID area where we have the red zone and the green zone. This happens to be our red zone. I'll move through here. Okay, this is our emergency department observation unit. So this is a 20-bed unit, and 12 of them are set aside for ED observation protocols. We have 30 ED observation protocols in which we can observe patients under the care of a nurse practitioner and avoid an unnecessary admission. So this is a pretty busy unit over here. You can see here lots of activity going on. We have enclosed rooms. It's a new unit, and this is Amy. She's one of our nurse practitioners. We're looking after 12 observation patients and then another 8 patients who are admitted to the hospital who are boarding ready to go upstairs. And so this has been a really great unit in order to avoid admissions. You can see we have an ultrasound machine over here. Our nurse practitioners are all credentialed in point-of-care ultrasound, and they use it quite a bit. So again, we have a nice interdisciplinary relationship with our nurse practitioners, working closely with them in the ED observation unit. As I'm sure you're already well aware, our most vulnerable patient population are those patients with mental health issues. And the hospital built us this behavioral guesting unit last year. It's an 8-bed unit, lockdown facility, where we can safely house our behavioral health patients. And they have nice, comfortable spaces like this. And it's just a nice way for us to provide them with the best, safest quality of care that we can. So this is the behavioral guesting unit. And it's staffed by a psychiatrist who's dedicated to the emergency department and these patients. So that's a brief recap of the UC Irvine Department of Emergency Medicine. Thank you very much for visiting us in a virtual way, and I hope to meet you someday in real life.